going to discuss the meeting we have with our community leaders across various sectors, from public safety, education, and our medical providers to discuss the COVID-19 situation that is, of course, impacting worldwide and include the cases that we're seeing here within the United States. We have several people here making comments. DeMargo, our City of El Paso Mayor, Rick Samaniego, the El Paso County Judge, Dr. Hector Ocaranza with the El Paso Health Authority, and then we'll follow with questions.
As Assistant Fire Chief Rodriguez mentioned, there is no COVID-19 cases in El Paso at this time, but as many of you, the members of the media, have reported the outbreak, it continues to expand worldwide. We get updates every day, including multiple areas throughout the United States. I understand New Rochelle, New York, was declared closed this morning. Again, El Paso currently does not have any cases, but we as a region have been meeting, discussing, and preparing. That's what we want to convey today. We have a threat assessment group that meets on a daily basis. A threat assessment group that meets on a daily basis. The City of El Paso, along with our public and private partners such as the County of El Paso, Fort Bliss, Ciudad Juarez area hospitals, our schools, all of our school districts, state and federal partners have been meeting and preparing plans and procedures in case they should be needed. There's a lot of misinformation out there being shared online, so we want to correct that misinformation. COVID-19 is most commonly spread from an infected person to others through, and let me cover these points: respiratory droplets released into the air by coughing or sneezing, close personal contact with an infected person such as touching or shaking hands, touching an object or surface with the virus on it, then touching your mouth, nose, or eyes before washing your hands. The Department of Public Health laboratory can test respiratory samples for COVID-19 here in El Paso. And we'll talk about the amount of tests we can do in just a minute, so everyone's aware. And our ability to test for COVID-19 here in El Paso will greatly reduce the turnaround time to get results for a patient. If we shipped out samples, it would take 72 hours to receive results, but the testing here will shorten that time to as little as 4 hours. Our first responders are going above and beyond the CDC requirements to protect themselves and our residents when it comes not only to COVID-19, but any disease. The public can do their part to prevent the spread of germs. Prevention of COVID-19 is the same as that for other respiratory illnesses, such as the flu. Basic steps, ladies and gentlemen. Cover your coughs and sneezes with a tissue or your upper arm and elbow. Clean your hands frequently with soap and water. Don't spread the germs. If you're sick, stay at home. Call your doctor. As I stated, and I'll repeat again, El Paso currently does not have any cases, but we as a region are working together to prevent the spread of any diseases and want the community to be aware that we are preparing and protecting our community. Before I ask Judge Samaniego to say a few words, I want to cover two things that keep repeating by multiple speakers. Number one, if you have a concern or an issue, call 211. 211 is fully equipped 24/7 to answer any questions that you may have as a patient or prospective patient, as an individual, or as a physician. Call 211. They're there and available. And I want to reiterate that we've been working very closely with the school districts to coordinate responses, to deal with where we are, and the public health of our students is critical, and our children, and we are on top of things. So let me turn it over to County Judge Ricardo Samaniego to say a few words.
Thank you, Mayor. I think if you look behind us, you'll see that's really the message. You look at the people behind us and the partnerships that we have, and I won't replicate and talk a lot about the symptoms, but I think we need to talk about the fact that El Paso is always very prepared. We've seen this at August 3rd, how we came together. We saw how we dealt with refugees. And so sometimes it's a little scary when you have this kind of activity that it seems to lead into we have a huge crisis. But I think as a community, we have to understand and that you have confidence that in these partnerships, we're really getting prepared if something were to happen. And that's sort of the nature of El Paso, the way we do things. And so I just want to make sure that you understand that we're getting ready in case of a situation, and we're looking at every element. We have all these partnerships. We're talking to everybody that we can. We're very fortunate with the county. I have what's called the Metro 6, which are the 6 largest counties, and the county judges, we communicate, you know, every day, any changes. We knew what happened with south to southwest. We knew that the fact that a lot of people were coming in from all over the world is one of the differences. And so if you could just sort of look at our community, and there's other communities, certain things are going to be happening in other communities, and so we don't take what happens there in relationship to what we have to do. We have a great team, and we're going to be very specific to El Paso and to our community, and we'll keep you informed. I want to let you know that the mayor and I are very united in not only these things, but in the strategy for El Paso, and so that is really helpful. And so thank you for being here. Thank you for looking at this as a preparedness and not as a crisis until we hear otherwise. Thank you very much.
And now we're going to bring up Dr. Carranza.
Good afternoon, I'm Dr. Hector Carranza, the health authority for the city and the county. And as the mayor said, the coronavirus is something that has caused a lot of fear. And we fear what we don't see. A virus is something that we don't see, but we can spread very easily by droplets, by touching contaminating surfaces, and by bringing our hands to our own face. So the message that we want to convey to the community is, one, first, not to fear. We know little by little what we have seen with this virus is that it causes a mild disease. It's a respiratory disease, but unfortunately it can be severe in those who are affected by other chronic conditions, for those that have an immune system that is depressed, and basically our elder people are the ones who need most of those underlying conditions. So we need to be prepared. We need to take care of those who are most vulnerable, and we have been in contact at the health department with all the organizations. We cross all over the city. We find those places where we find the most vulnerable ones, where we have spoken to the children, with all the superintendents, the hospitals, and everybody who participates in this community. So we need to send that message to the community that the way to stop the spread of this virus is, one, wash your hands often. Be careful where you touch. Don't touch your face. The face is the main entrance of all those viruses to the body. And whenever we use a tissue, dispose it appropriately. We need to cover a cup in the inner part of our elbow. And if you feel sick, call and get more recommendations from your healthcare provider. So, as we heard over and over, you know, we stand and together we can fight all this. And we've been doing it all over with many other viruses, and we will continue doing this for the coronavirus 19.
We've also been in contact with companies here who provide critical basic services within our region, such as the electric company. And these entities have numerous contingency plans in place, and they are prepared to continue to provide safe and reliable service to our region in the event of a pandemic affecting our community. So they're prepared. Jorge, you want to come up? Y'all, we'll stop here and answer questions if you have.
I've got a question. So just wondering, how many testing kits specifically does the city of El Paso have? And are these kits only available right now at the city health department?
My name is Darlene Tarango. I'm the laboratory manager for the City of El Paso Department of Public Health Laboratory. Currently, we have enough to test 400 patients. And we can get another testing kit within 24 hours from the CDC.
And are those only available at the health department or various, I guess, places throughout El Paso?
Currently, it's only with the health department.
So that won't impact how quickly the test results can come back to you if there are more cases coming into hospitals?
We were told earlier that we could do a 24-hour request for more test kits. But at the same time, we want to avoid somebody who has a common cold thinking they have COVID-19 and requiring testing. We've got to go through certain protocols from a health standpoint to be able to justify that, and the physicians and hospitals are involved on it.
Mr. Mayor, one group that is missing the current water plant is WISE, and we're in contact with WISE. We understand that they have 3 Italians in quarantine over there right now, they're live over the weekend.
We are in contact with Juarez. I'm not aware of any cases over there at this time. So, Jorge, I'll let you know.
So the health department is in communication with Juarez officials twice a day, so they have constant communication back and forth, getting continual updates for what's happening in Mexico and other Mexican states. What was the question?
The audio is reporting that there are 3 Italians that arrived over the weekend that are in quarantine right now.
So what we do know, well, let me pass it on to Fernando. Fernando is the one that speaks with the Juarez officials every day.
So your question, sir? Please.
I cannot disclose the nationality of the persons that are under monitoring, which we don't know the exact number, but we have been receiving notices from the Juarez authorities. They have had persons under investigation and under monitoring. Yes. Well, what happens is that mostly or directly, we emphasize on the individuals coming from China, which are the ones that are at higher risk from the Hubei province. And we receive notices immediately from the federal authorities that are located in the 11 airports in the United States in order for us to follow with monitoring for them. The mid-risk are travelers or persons in contact with individuals from the other countries that have massive or, massive transmission in their countries. Italy, Iran, Japan, and South Korea. So those are the ones that are at mid-risk, and then lower risk are local contacts and households for persons that are not sick, asymptomatic, and then for each one of them, we decided they are going to be monitoring from the health department, or is going to be self-monitoring, reported to the health department on a regular basis.
Do you expect that the spread of the coronavirus is going to be inevitable and especially perhaps in Juarez? And at what point might the bridges be closed down to more commercial traffic and how to passenger traffic coming across?
I don't have a clear answer for you. I mean, some of the states of emergency. You want to clarify?
My name is Luis Coronado with City International Bridges. So we had a meeting with CP this morning, discussed this issue with them. They told us that they are in contact with the CDC and that today there are no plans to close, whether temporarily or permanently close the bridges within the Paso district. They're going to continue to monitor the situation and then keep us updated. But that's as of this morning. So we were in close contact with them on a regular basis, and so nothing changes. The ports will continue to operate commercial, pedestrian, and vehicle traffic.
I can understand obviously there's no reason to do it now, but is there a point at which that might be the thing to do? And at what point would that be? X number of cases that basically turned up water, 5, 6, 7, 8. At some point, that's probably be 60% down the path.
Right. So from the city side, I can't give you that number. They told us that they are going to rely on the CDC to give direction. Again, as of this point right now, there are no plans to modify the productivity.
Our purpose in being here today is to tell you what we're doing from a proactive standpoint, how we're prepared, but we're also not going to knee jerk and we're gonna be deliberate in that. Public safety is public safety, public health is our primary concern. That's why we're having this meeting. We will do whatever is required at the time to protect the citizens of El Paso from a public health and safety standpoint. But there are a lot of moving parts to this thing. We have school districts with children coming from Juarez. We have a number of issues going on. We have commerce going back and forth with the maquilas. It is a critical component to this community. So we will be very deliberate in our decisions as to what we need to do to protect the health and safety of our community. I'm not sure, I haven't had the chance to talk to Mayor Adler. I'm not sure exactly why on the South by Southwest closure, but we will, or his declared emergency, but we will monitor them. As of right now, there are no cases in El Paso. I'm told there are no cases in New Mexico, and we haven't heard of anything confirmed here on the border. So we'll proceed accordingly. Other questions?
How will uninsured patients be treated and tested should a patient, come up positive with the coronavirus?
Well, the hospitals will, and us will deal with that. The testing will proceed. Let's put it that way. The testing will proceed. There was an announcement this morning with, I think, a press conference with the Vice President of health insurance carriers saying they were going to waive their co-pays for testing. We'll do whatever is necessary to continue to protect the public of El Paso, period.
What is the capacity for, for people who may be quarantined at health facilities if this virus comes to El Paso?
Most of the quarantines, if they're not ill in the hospitals, have been at home or elsewhere.
Okay.
So I would say there's not a limitation there, but I don't know any health.
Well, one of the things we need to remind everybody, as I said, if this coronavirus disease is mild, then stay at home and don't go to work, and don't go to other places where we can infect other people. We hopefully don't see that many cases that are going to be severe, and the hospitals are well equipped to take care of the patients, and our main responsibility is to take care of our community. That's what we're here for, and that's what we want to send a message to. And first of all, don't be alarmed. The disease, what we're seeing is that it's mild. If it is more severe, then definitely we can take care of those patients and the members of our community and our hospitals that have the resources that we need to do that.
You say that, I'd like to bring this to Ascendus because we need to look at it categorically as to where some of the areas of vulnerability, and so that we don't see this as something that's spread throughout all the age groups. So he had a great presentation on this.
Again, Robert Resendiz, Director of the Health Department. And one of the things that we're seeing with this disease, it's not a one-size-fits-all. It's being very specific. And what we're seeing is that people over 80 years of age are the most susceptible to this virus, including fatalities. It's about a 15 to 16% death rate for an 80-plus-year-old who gets infected. If you're in your 70s, it's half that. It's about 8%. If you're in your 60s, it's half that, about 4%. It keeps going down. Once you get under 50, so 0 to 49 statistically, very little, just rare cases where someone would get sick and die from it. Very, very small, less than 0.5% across each of those decades wide. So when we talk with the schools, we care about our children, of course we do. But so far with this disease, as it's been expressing itself in less than 3 months, is that the children aren't affected. Children aren't dying from this disease, but our seniors are. So as we work on our plan, as this thing grows, if the disease continues to behave the way it has behaved so far, we need to care about our seniors. We need to isolate them from the virus. We need to protect them from the virus. Some other communities have already implemented some changes, like restricting visitors in nursing homes. Hospitals do that regularly. When we had measles, to go to the hospital, the children weren't allowed in hospitals as visitors. There are some containment things that we can do, that we have done, that are effective, and I foresee these coming with coronavirus as it's.
Sir, can you tell us how many tests you guys have done so far?
One.
You guys have only tested one patient for coronavirus here in El Paso?
One patient for coronavirus. There is a possibility that we might be doing more testing, but not for El Pasoans. some of the other parts of Texas are running out of kits, or they have too many cases, we're like a backup for them. So there is a possibility that we could do more testing.
How many tests do suspected cases go through in order for them to be cleared of the coronavirus?
If there's suspected cases, they may not necessarily be get tested because they may not have symptoms. It's a complex list of things that you have to. Did you go to China? You said, no, we had a woman who insisted we test her brother, and we interviewed her. Where has he traveled? Well, he hasn't. And why do you want us to test him? He saw Asians in the community. We need to stop that. This is not a racist disease. It's good science, but fear and sometimes, and I'll say ignorance. It's important that we educate our people so that they know. They're usually afraid of the things you're unfamiliar with or unknown, and this is new and unknown. So we really need to work together to educate the public of what this is and what it isn't.
Can we get a comment in Spanish?
Population. What is the elderly population in El Paso? And are you working directly with nursing homes?
We're meeting with the Association of Nursing Homes. It's either later this week or early next week to discuss these control measures that they can put in place to protect our elderly. I missed the first part of your question.
What is the elderly population in El Paso approximately?
I don't know that offhand.
Has the cost been discussed as far as to testing for the actual virus?
The testing right now, since we get the test kits free from the CDC, we do the testing for free as well.
I want to follow up on.
For those, I think I may have been mentioned earlier, for those who do send to the private labs, Quest and LabCorp, they're only testing right now in California and Washington for people up from California and Washington, and the price for that's $199.
I want to follow up on something you said. You said that we are the backup. You're going to be testing people outside of El Paso. Will you be going there to test them, or will you be bringing them here?
They would send the specimens to us.
If we can get a comment in Spanish, please, from any part of the members.
So we can have Spanish interviews after this press conference, but I've asked last two questions, please.
Any other questions?
So with South by Southwest being canceled, has the city made any plans to cancel any gatherings that we have coming up here?
No, we've not. We have no plans at this time for anything else. Thank you.